Are long-term antibiotics for UTIs safe? Imagine battling recurrent urinary tract infections and wondering if taking antibiotics for a long time is safe. It's a common question, especially for those who struggle with frequent infections. Long-term antibiotics can be helpful in preventing recurring UTIs, but they are not without risks. These medications are usually prescribed in low doses over months to reduce infection episodes, especially in people with underlying bladder issues or very frequent infections. The idea is to give the bladder time to heal and lower the chances of infection coming back. However, evidence shows that the benefits often don't last beyond 6 to 12 months, and long-term use should be carefully managed by a healthcare professional. Extended full-dose courses, like taking antibiotics for a month or more, might reduce recurrence, but more research is needed to confirm their safety and effectiveness over such periods. One of the biggest concerns with long-term antibiotic use is the development of antibiotic resistance. When antibiotics are used over a long time, bacteria can adapt and become resistant, making future infections harder to treat. This resistance can lead to more severe or complicated infections that are difficult to clear. Besides resistance, patients might experience side effects such as stomach upset, yeast infections, or even toxicity to organs like the liver or kidneys. These adverse effects can impact quality of life and sometimes lead to discontinuing treatment. Monitoring is crucial. Patients on long-term antibiotics should see their healthcare provider regularly, at least every 3 months. These visits help evaluate if the antibiotics are still needed, check for side effects, and decide whether to continue or stop the medication. It's also important to consider non-antibiotic approaches, such as behavioral changes or supplements like D-mannose, which some studies suggest might help reduce infection risk. These strategies are being explored as ways to lower reliance on antibiotics, especially in high-risk individuals. From a bladder health perspective, preventing recurrent infections is important because ongoing inflammation can damage the bladder lining over time. Chronic bladder inflammation has been linked to issues like bladder discomfort and, in some cases, increased risk of bladder problems. However, overusing antibiotics can disturb the normal balance of bacteria in the urinary tract, which might cause other issues. Currently, there is no direct evidence linking long-term antibiotic use for UTIs to bladder cancer, but maintaining healthy bladder tissue is essential. In summary, while long-term antibiotics can help reduce recurrent urinary tract infections, they come with notable risks, including antibiotic resistance and side effects. Such treatment should always be personalized, limited in duration, and closely supervised by a healthcare professional. Patients should avoid self-medicating and work with their doctor to develop a comprehensive plan that balances infection prevention with overall bladder health. Always consult a healthcare provider for tailored advice and consider all available options to keep your urinary health in the best shape possible.